Okay, this video is going to focus now on evaluating the humanistic approach. The key thing for you to know really about the humanistic approach is that it is entirely different to the psychology and the paradigms that came before it. If we think where this is placed in the 1950s, this emerged as a response to behaviorism and the psychodynamic approach. And compared to those two approaches, this is much, much more positive. This approach advocates for the value of personal ideas and self-fulfillment, and the humanists really argued that, they're bringing the person back into psychology. They were promoting a positive image of the human condition. If we think, Freud saw human beings as slaves to their unconscious, and he claimed that all of us existed somewhere between unhappiness and despair. The behaviorists argue that humans are no different to lab rats, that we are not thinking or feeling, that we are simply animals who learn to respond to our environment, and we are the sum of our conditioning. So humanistic psychology offers a really refreshing and optimistic alternative. It sees people as basically good and free to work towards the achievement of their potential. So if nothing else, the humanists did put the person back into psychology, and we've taken a lot of their ideas, particularly in the application of clinical psychology. So we're going to be looking at a few key areas here. The influence on counselling, which is particularly the work of Rogers, which still exists in CBT and other talking therapies today. We'll be looking at the emphasis on free will as ultimately a positive thing. However, there are issues here that it is perhaps incompatible with science. And we'll be looking at the lack of empirical evidence. Now, the humanists are anti-science. They are not particularly concerned with whether psychology or humanistic psychology is empirical and scientific. In fact, they reject the scientific method when studying humans. But nevertheless, we really do need to consider whether their ideas would meet the criteria for science today. Let's start with the influence on counselling psychology, and particularly the work of Carl Rogers, who is a bit of a cult hero in this world. An important application of the humanistic approach has been in counselling psychology. The primary application has been in client or person-centred therapy. Notice that they are not a patient, they are a client or a person, and that's really an important feature of modern day psychotherapy like CBT. In client-centered therapy, the therapy is directed by the client, not the therapist. And it's the client who's encouraged towards the discovery of their own solutions. They are the experts on their own condition, and within them, they have the solutions to better themselves. And if we just think back to the quote about the potato that Rogers was kind of famous for, he thought that each client has within him or herself the vast resources for self-understanding and for altering their attitudes, self-concept and behaviour. He thought that, like a potato growing in a dark basement, we all have within us the power to grow, and we all have that innate need for fulfillment. And that is sort of what underpins all of his client-centered therapy. He thought that for the therapist, the aim of the therapist is to encourage the client towards discovering their own solutions. And that's got to be within a therapeutic atmosphere that is warm, supportive, and non-judgmental. And he coined this phrase, unconditional positive regard. For Rogers, an effective therapist should provide the client with genuineness, with empathy, with openness, with support and acceptance, regardless of what they say or what they do. And sometimes that could be really difficult, but it's the aim of the therapist to just show complete empathy and genuineness all the time. There's a video that I'll get you to watch where we see Rogers really emphasizing this, that for the therapist, it's not their role to be an expert. It's not even their role to be a psychologist. They should really just be there as their true, authentic, genuine selves, and to just help and encourage the person to discover their own solutions to their problems. And this is really all to help increase the person's feelings of self-worth, to reduce the level of incongruence, that gap between their self and their ideal self. We want to have no gap. We want to achieve congruence there. So we're trying to reduce incongruence. And this is going to help the person to become fully functioning and to be their best selves. Roger's work really did transform psychotherapy. His counselling techniques are now practiced all across the world, not just in clinical psychology, but we see these elements in coaching, which is a big thing in lots and lots of industries, in education, in health, in social work, in corporations, where rather than having a mentor who tells you what to do, you have a coach who helps you come up with the solutions to your own problems. So client-centered therapy and the use of unconditional positive regard to overcome conditions of worth has really revolutionized counseling psychology. Although it must be said that this isn't going to be effective for more serious psychological issues. CCT, client-centered therapy, is good at reducing low self-esteem, it's good for treating anxiety and depression, but more severe disorders, for example schizophrenia, wouldn't really lend themselves to client-centered therapy. In that case, it wouldn't be suitable or ethical to let the client come up with their own solutions. A further strength of the humanistic approach is that it emphasizes free will. Humanistic psychologists reject the notion of determinism. They think this is pessimistic, and they think that this is incompatible with how humans live their lives. So they believe that we have free will, and they strongly advocate the idea that human behavior is not the result of any single cause. Ultimately, they just believe that we are self-determining. And this is really important. This is really important. While they acknowledge that there are some constraints on our behavior, so for example, it could be biological or environmental constraints, ultimately, they believe that we are still free agents, that we are still autonomous and still free to choose our behavior. So, okay, maybe our choices might be restricted by our certain circumstances, but ultimately we are still free to choose our behavior and our beliefs. So they advocate for free will. And as I said, this is a really important stance, and this is the only approach which advocates for free will. And it's important because many psychologists, many theorists, many legal experts also believe that we have free will. They reject a deterministic point of view. And the idea of free will, it's really central to the way that we understand ourselves as autonomous agents. We fundamentally believe in free will. If we ask any person, they believe that they are in charge of their destiny. And I think in order to expect moral responsibility in terms of, say, courts, one must accept the concept of free will. So this is kind of central to how we live our lives. And if we just take the legal example for a moment, if we look at criminality, there would be no point in putting people in prison if they themselves didn't choose to commit a crime. There would be no point in putting a child in detention if they didn't choose to break the rules. This assumption underpins everything, that humans have the choice in how to behave. Therefore, the assumption that humans have free will is a strength of this approach, because it really is the only approach that recognizes that humans are autonomous, that we have choice, and our society really is structured on this assumption. However, this approach, therefore, is incompatible with science. Science is heavily deterministic in its search for causal relationships. The whole point of science is to seek to discover whether X causes Y, or whether the IV has an effect on the DV. Therefore, if we're assuming that human behavior doesn't follow this causal explanation, then this is incompatible with science, because they believe that free will then is a force outside of cause and effect, and therefore is the only thing in the known universe that doesn't follow the laws of causality. However, in response to that, humanists don't really care. Humanists reject the scientific method. They don't care that free will is incompatible with science, because they believe that the scientific method is not the appropriate process for understanding the human experience. So for humanists, it's not really a problem that free will is incompatible with the causal laws of the universe. Nevertheless, it's really important for us to understand where the humanists stand on empiricism and some of the other fundamental features of science. All of this needs to be said sort of in the context that humanists are proudly anti-science. They don't believe that the scientific method applies to human behaviour. And so it doesn't really follow many or any of the features of science that many of the other approaches do follow. So some ways in which this approach is anti-science. Number one, I guess, is that most of the evidence, I'm going to use evidence maybe in inverted commas there, used to support the approach actually fails to establish a causal relationship between variables. It can't really establish clear links. So for example, the studies are kind of unclear as to whether incongruence leads to poor mental health, for example. In addition to that, a lot of the ways that we measure these concepts, so for example, measuring the self-concept using the Q-sort or measuring self-actualization via self-reports, they're always based on questionnaires and self-report method, which we know is highly subjective. In addition to that, many of the humanistic concepts, like self-actualization, like self, are very difficult for us to clearly define and operationalize, which makes it then very hard to measure. Yes, there is a self-actualization questionnaire, but given self-actualization is really unique to the individual, how can one questionnaire suit everybody? So I guess without supportive experimental empirical evidence, we can't necessarily trust the humanistic theories or indeed trust the therapies that have been proposed by the humanistic approach. So by modern scientific standards, the humanistic approach lacks empirical evidence to support its claims. Now, I just want to really emphasize here that the humanistic approach is anti-science. That is not the same as pseudoscience. Pseudoscience is fake science, as in it's claiming that it is scientific when in fact it is not. The humanistic approach is not pseudoscience because it's not claiming to be scientific, it's rejecting science. So the ideas aren't, for example, inherently unfalsifiable. For example, the idea of the self could perhaps be tested and proven false, but it's just that the concepts are really hard to operationalize, really hard to create sort of concrete, objective definitions, and that poses problems for empirical investigation. Also note that we're not trying to create universal laws here, we're not trying to test things experimentally. The humanists are intentionally trying to not create universal definitions that can be tested. They're trying to intentionally promote subjectivity because they believe that humans are unique and therefore they should be studied as such. So this is anti-science, which is not pseudoscience. They're not trying to be scientific. They are trying to reject science here. So very different to the psychodynamic approach.